Hi, we're back here today with Dr. Carolyn Eaton, and today we're going to be talking about medications that affect sexual function. Welcome to Sounds Healthy, a podcast of University Health System. I'm your host, Elizabeth Allen. Just a quick note here. This episode contains adult-oriented themes and may not be appropriate for small children, or even older children if you're not ready to have the talk. Hi, Dr. Eaton. How are you?
I'm doing great. Thank you, Elizabeth.
And now, Dr. Eaton, is this a kind of question that patients bring to you about their medications, or is this something you figure out when they tell you something's not quite right with their sex life?
Most of the time, it's something that comes up. They'll have been started on a new medication, and they'll realize typically in the first month or so that they're not performing as well. Whether, I know, a woman's having a harder time having an orgasm, a gentleman's having a harder time having an erection, they will typically be able to associate it with the new medication. Sometimes the issue comes and they just come in requesting erectile dysfunction medications or something else, and then that's when we go through their medication list and can say, okay, well, this is probably causing the problem.
And you say medication list like it's a long one.
Well, in a number of my patients, that is definitely the case. I have a tendency to have patients with multiple chronic conditions, yes.
There seems to be, there just seems to be a lot of medications out there that help us with a lot of different things.
Absolutely. And for every good effect, there's always the potential for a side effect or a downside.
That sounds like quite the downside.
Yeah, unfortunately, and we can't always take away the offending medication. But sometimes we can substitute it for something else.
Can we talk a little bit about the main offenders, as it were?
Absolutely. Number one is probably going to be the antidepressants, anxiolytics as well. These, of course, are very commonly used medications. I say close to 50% of all Americans at some time in their life will experience depression. And most of those people do end up seeking advice from their physicians. And the most common medication we use are something called serotonin selective reuptake inhibitors. This is your Prozac, Paxil, Lexapro. And they're well tolerated. They're now very inexpensive, and so they're among the most commonly used. The problem is they tend to cause a significant drop in libido.
What do you do about that? You want to not be miserable, but you want to not be miserable.
Absolutely want them not to be miserable. If they're getting a lot better and they should be able to come off the medication in 6 to 9 months, sometimes we'll just have them say, okay, it's working, you're getting less depressed, we'll see how you do, we'll be able to reduce the medication and then take you off of it. There are secondary antidepressants we'll sometimes use to help reduce that as a side effect. It'll help improve energy level, help slightly improve erectile function, can improve a libido a little bit. And it's another antidepressant, one called bupropion at low doses we'll sometimes use for that. But as I said, sometimes we can try a different medication or a different class of medication.
What do your patients say when you tell them that their antidepressant may be interfering with their libido?
Well, you just have to have a frank and honest discussion with them. You have to say, look, this is a medication that can do this. We can try something different. It may not work as well if the antidepressant is working very well for them. So you just kind of have to go back and forth and say, okay, which of these things is going to be the more important for you right now in your life?
Okay. What are some of the other things you've run into?
A lot of the anxiolytics, they're very commonly used, the benzodiazepines, which is your Xanax, your clonazepam, Ativan, also called lorazepam. They also can reduce libido. And again, those are ones that are a little easier to take people off of in the medical sense because we don't like people taking them routinely anyway. So if we can just reduce people to using them on a strictly as-needed basis or changing their anxiolytic altogether, that is the preferred. And then the last one in the mental health area are the atypical antipsychotics. Now, most people who use these are not psychotic. They don't have schizophrenia or severe bipolar disorder. We actually end up using a number of them for insomnia. And so, unfortunately, that's one of the areas that people will see a dramatic drop in libido with, like, your quetiapine, which is Seroquel, risperidone, which is Risperidol, and those will then take them off of that medication completely and just use a completely different class of medicine.
I see. And you have here also on your list, this has to be a big one, antihypertensive.
Yes, this is the next biggest grouping. And the biggest offender in the group are the very common heart drugs called beta blockers. Now, beta blockers, if a person has congestive heart failure, has had a recent heart attack, you absolutely positively have to be on a beta blocker. They will help extend life. They will help you get better. And so that's, if you have a side effect to your beta blocker, we'll do our best to work around it. Using, as I mentioned, other podcast about erectile dysfunction medication and those kinds of things is what we'll need to do because we cannot take you off of those. If your insurance will cover a particular beta blocker called nebivolol, which is also called Bistolic, sometimes that can be a good substitution because that is the only beta blocker that has not been shown to cause erectile dysfunction.
It must be very popular.
It's expensive. And so unfortunately, no, it's actually not covered by a lot of the insurers, and it's expensive. And so it's a lot harder. It's harder to get it covered. And it should be more popular. And as it becomes generic and more widely generic, it will become popular. But as of right now, it is less used simply because of cost.
So stay on your beta blockers.
Yes.
Don't die.
Yes.
We'll figure it out.
Right. Absolutely. And that's true of any of these medications, too. If you're having a problem with it, come and talk to your doctor first before you stop your medication. That is really essential because we don't write these medications for our health. We are writing these medications to help keep you alive, keep you functioning, keep you healthy, and stopping them suddenly is not an option. So go in, talk to your doctor, and make sure that whatever changes need to be made are made in conjunction with your physician. All right. Another common class for the antihypertensives are diuretics, and this is your hydrochlorothiazide, your chlorthalidone, furosemide, torsemide, and the thiazide diuretics, which are the first two, the hydrochlorothiazide and chlorthalidone, can actually cause erectile dysfunction in up to about 30% of men. And so again, this is one of the most commonly used blood pressure medications. It is almost always our first-line blood pressure medication. And so this is one of the ones I will commonly get back from the patient comes back to see me 4 to 6 weeks later, getting their blood pressure check, and they're having issues. And that is one we can pretty easily change to something else.
So you've got also angiotensin.
Receptor blockers, yes. I know. We refer to them as ARBs, ARBs.
Oh.
It's a lot easier way to say it.
ARBs.
ARBs. And these are actually ones that they're great blood pressure medications because they not only help keep the blood pressure down, they're very beneficial for the heart and they're very beneficial for the kidneys. I've actually even had some studies show that in men, they can actually cause an increase in sexual function. Other ones show a slight decrease. And women who take the ARBs over other medications are more likely to stay sexually active. So this is actually one of the medications we like people to be on. It's one of the medications we'll change you to if we can, if you're having a side effect from the other medications. And this is going to be your losartan, your valsartan, your irbesartan, the sartans as a group.
Why wouldn't you just start with those?
Actually, one of the reasons recently has been this has been one of the class of medications that there's been a problem in the production of the medication. Now, the medications, when they get properly made, are great. They're healthy. They're fabulous. The problem is in the manufacturing process, there's this chemical that gets created that is a potential carcinogen. And with some of the generic manufacturing companies, they've skipped a very essential step that removes that potential carcinogen. And that's why they've been under a lot of recalls here lately. And so a lot of people are nervous about taking them. But if you are taking one that has been properly made, you are taking a good, safe drug. But there's been a lot of concern about them lately because of the manufacturing process. And then the last one we talk about on this particular area of antihypertensive are your ACE inhibitors. Luckily, in men, there's really not a lot of sexual dysfunction, so that's really good. And women tend to do pretty well as well with ACE inhibitors. These are readily available. They're inexpensive. But in about 5 to 10% of people, they can cause an irritating chronic cough. So again, that's one of the ones that, we do commonly use them, but that trade-off of, okay, it helps the blood pressure, you're not going to have that decrease in sexual function, but you're going to get this annoying, irritating cough. And that's also something that people will be on these medications for 6 months to a year, have come in over and over for their allergies or a cold or whatever because of this chronic cough, and it turns out it's a side effect to their medication.
So that's one of the questions for the doctor to ask.
Absolutely. When you come in, have you developed a cough? Or if they have a cough, okay, is this associated with congestion and this and that and the other thing? And if it is, okay, we're talking about a cold or that. If it's just an isolated cough, then we're talking about a side effect.
So that's the example of every time you go to the doctor's office, they always ask you to list all your medications. There's a reason.
Absolutely. Because all these medications, and it's best if you can just bring your bottles in, because so many people will come in, oh, I don't know, my cardiologist gave me this little white pill. I'm supposed to take it at bedtime. Yeah, there's no way, if I have not already received your cardiologist note, to know what that little white pill is. So it's best to always bring your medication bottles with you as well. All right. Let's see. And there's a lot of other, minor other antihypertensives. We don't use them quite as commonly. That, if you're taking those, if you have an issue, you can talk about it. But they're not used quite as often as the first 4 that we talked about. Another area of erectile dysfunction is actually from pain medications. And this is, again, very prevalent, especially in people over 40. So everybody's heard about the opioid crisis, people overusing opioids. But one of the big side effects of people taking opioids is erectile dysfunction. Men who take over what's called 120 morphine equivalents, which would be the equivalent of 12 Lortabs a day, they would actually, about half of men, or a little bit more than half of men, would experience erectile dysfunction. And even those who take much lower doses, about 1 in 8, will actually experience erectile dysfunction.
Well, that seems to make sense in terms of the way you associate the physiological effects of opioids but it's also a situation where you're often dealing with a lot of pain.
Right.
So it might be a little more difficult for them to say, I'm just going to stop taking this.
Well, sometimes we have to go through and see what other ways to manage pain. And what we're finding, of course, is that with the opioids, a lot of people have been taking them without really needing to be taking that much opioid or that much medication. Now, this is a very touchy subject, and I recognize that. There are people who deal with severe daily chronic pain, and they just can't manage without them. And with the backlash with the people that have been overtaking them or taking them inappropriately, they're having a harder time getting them, and there's a lot of back and forth with this. But what I'm going to be talking about today is the ED issue with it. And yes, pain will also affect the sexual function as well. But also people who take the higher doses are going to be more likely to have secondary sexual dysfunction as a direct side effect of the medications. And even other pain medications sometimes will also cause ED issues. The things that we try to get people away from the opioids and use sometimes can also cause that. Non-steroidal anti-inflammatories are also associated with ED at higher doses especially. Although we think this is more going back into that vascular effect in the same way that high cholesterol, high triglycerides, and those issues activate it, because we know that a lot of the nonsteroidal anti-inflammatories can cause a reduction in blood flow. And the one that's least likely to do that is one called naproxen, along with aspirin. Those are the 2 least likely to do it. And there's not really been a head-to-head of naproxen versus other nonsteroidals when it comes to an erectile dysfunction area. We have seen it as a head-to-head when it comes to coronary artery disease. And we have seen that there's less of a increase in heart attacks in people taking naproxen versus people taking other nonsteroidal anti-inflammatories.
So you just have to weigh it all out again.
Absolutely.
And have that conversation.
When it comes to muscle relaxers, they are commonly used to help with spasms in the back, spasms in the legs, and they can also cause a little bit of an ED issue as well, though there are no definite numbers. There's just case reports. And what we think they do is because they relax the skeletal muscle, that can have an effect on also relaxing some of the blood vessels and then them not being able to respond the way they're supposed to when sex occurs. I know I'm a doctor. What can I say? I have different phraseology sometimes. So,
what about women?
Women really have an issue with being able to tighten the vaginal tract sometimes with muscle relaxers. And so it can make them feel a little bit more floppy and probably have less really good contact. So, but there's some over-the-counter medications, too, that can cause some ED issues. And these are especially bad for women, though. Antihistamines, diphenhydramine, which is Benadryl, probably most common. It doesn't just make you sleepy. It can cause both erectile dysfunction and vaginal dryness, so neither one of the couple can have any fun. Then the non-sedating antihistamines, the loratadine, which is Claritin, cetirizine, Zyrtec, the less sedating ones, they have less side effects than the diphenhydramine do, but they can still cause some dryness for women, some mild ED issues with men, especially if you're using them day to day, because it does have a compounding effect. When it comes to decongestants, which is your phenylephrine and pseudoephedrine, they typically cause more of an issue for women. They cause severe vaginal dryness in women and can aggravate incontinence. So if women are already dealing with incontinence issues, pseudoephedrine and phenylephrine will make that worse, and that can also be hard during sexual intercourse. In men, we actually use decongestants to treat something called retrograde ejaculation. So men really don't have too much of an issue with the decongestants.
But with regards to antihistamines particularly and decongestants for women, we live in allergy central.
San Antonio is definitely one of the worst areas in the country for allergies. I typically recommend most of the nasal sprays more so than the oral decongestants, especially Flonase, which is a fluticasone nasal spray, the steroid nasal spray. So Flonase, Nasonex, Rhinocort, those are all very effective. They help reduce the swelling and irritation, and because they're very localized in the nasal passages, they're much less likely to cause any issues with either the ED or the vaginal dryness.
At last, a simple answer.
That's right. It's not all this and actually in Flonase it's also over the counter. So you don't even have to go from one over the counter to the other without even talking to your doctor about that one. So.
Well, thank you for talking with us about this today.
Well, thank you, Elizabeth, for having me today.
You've been listening to Sounds Healthy, a production of University Health System in San Antonio, Texas. Produced and directed by me, Elizabeth Allen. Editing and audio production by Mark Greenberg. Web and digital support by Selena Mejia and Joe Campa. Executive producer Lenny Kirkman. If you like what you're hearing, be sure to subscribe on your favorite podcast channel.